Hello everyone, good afternoon. This is Vibi. So I'm back with the video, guys. So you can see here I have got a question paper for you, which is completely based on central nervous system. So these are mild to tough questions. So there will be 120 questions and 70 questions will be of nursing. So let's start the video. Before diving into the video, I would like to place a request for you people. Please subscribe this channel and please share the video with your friends and nurses, co-nurses, please. Okay, let's dive into the video. First question: cold calorie test used to check the functioning of. We all know that there will be a test called cold calorie test. So what it is used for mainly? So to check the normal functioning of brain stem, that is pons medulla, will carry out the cold calorie test. So this test is primarily diagnose the damage to the acoustic nerve and the brainstem. So acoustic nerve is nothing but the auditory nerve. So auditory nerve and the brainstem functioning is checked by using the test called cold calorie test. Next is aneurysm affects which layer of the artery. We all know artery is a blood vessels and it has 3 layers. So which layer affects when there is aneurysm in the body? So if artery is affected with aneurysm, it affects tunica media, the middle layer of the artery. We all know that artery has 3 layers and the middle layer is called tunica media. Next, before the procedure, obtaining informed consent is a responsibility of. So whatever the procedure may be, like doing endoscopy or bronchoscopy or doing ultrasound or doing x-ray, even a small x-ray, okay, we should get the consent from the patient. We need to get the consent that he is okay or he is willing to undergo the investigation procedure or any procedure. So the duty of taking consent from the patient is of physicians, that is a doctor should take the consent. It is the job of a doctor. Okay, next, when a nurse enters the patient's room for administering medications, she notices that the patient food remained on the table. Helping patient to eat food and then giving medicine is called beneficence. Okay, there are a lot of procedures, or there are a lot of words used in nursing where we call like ignoring the patient or um, giving the wrong medicine or misguiding the patient. So all of these are some negative factors. The positive factor is beneficence. Okay, along with the medicine will encourage the patient to take the food. Next, the difference between apical pulse and the radial pulse is called pulse deficit. We all know there are about 9 to 10 places in which we in our body where we take out the pulse. So radial pulse is something we normally take out from the thumb area. So and the apical pulse is the direct pulse where we take at the apex of the heart. So there will be difference between the both radial pulse and apical pulse. So radial pulse will be around 60 to 80 while apical pulse will be different. So the difference between these two pulses is called pulse deficit. Okay, next is apical pulse is assessed by placing the diaphragm of the stethoscope at the area of. I've already said the apical pulse is taken at the apex of the heart. So but where should you place the diaphragm to listen the heart sounds clearly or the heart rate clearly is mitral area. You know the mitral valve. Okay, the mitral valve, you should blindly keep the stethoscope on the mitral valve of the heart. Next, 7. Sudden fall of temperature is called dash. Crisis. Crisis is the other name given for a temperature fall. If there is sudden fall of temperature in a patient, then it is called crisis. Next, 8th question. In a patient receiving IV fluids, sluggish flow, redness and tenderness at the site of the cannula indicates venous spasm. We all know if we keep a cannula and giving down the medications continuously, there will be a hardened red surface is seen over the cannula, over the cannulated site. So that is the indication that the patient is suffering from venous spasm. Next, the Z-track method of intramuscular injection is used at preferably. So we all know the Z-track, that Z-track is stretching out the skin and giving the medicine and again loosening that the stretched skin part and again pouring the medicine is called Z-track method. So what does that method site, preferable site. So where we'll give this Z-track method most preferably. So that is ventrogluteal site. We all know that gluteal muscle is the most bulkiest muscle in the human body. So obviously we'll choose the bulkiest muscle so that there won't be any pain. Next is antidote for heparin is, so if the patient is on heparin therapy continuously, like all 4 times a day, and we notice that there is something wrong with the patient, and we'll send the test, clotting factors test, and the clotting time is less, and we'll get to know that the heparin is overly given, so and the clotting mechanism has been disturbed. So then we'll give protamine sulfate, which will act as antidote for heparin toxicity. So this is the video, guys. If you have any doubts regarding the video, please comment down in the comment section, and also join the WhatsApp group through the link I will be providing in the description or in the comment section. So please give our suggestions on what we should make videos on which topics. So the 11th question for you guys: what is the maximum volume that can be given as IM injection in adult? Okay, so what is the maximum volume of injection we can give through intramuscular site? So this is the question, guys. If you know answer, please comment down in the comment section. This is Bibi signing off. Bye.